to this special edition of the Career Cafe. I'm your host, Dr. Troy Podell, and with us are three very special guests from Brandywine Hospital. You guys are special guests, who certainly defy my ability to introduce, so I'm going to allow them to introduce themselves. Leo, if we could start with you.
I'll just start introducing myself. My name is Leo Scacia. I'm a registered nurse and paramedic, and I'm the director of pre-hospital services at Brandywine Hospital.
I'm Cheryl Pryskowski, Oncology Nurse Navigator.
And I am Dave Klein. I am the Director of Admissions for our Behavioral Health Program at the hospital, as well as Director for our regionalization of behavioral health services. And essentially what that means is I help to look at our community's needs in terms of advancing initiatives for mental health services within our community.
Welcome, welcome. And David, you kind of glommed onto what my first question was going to be. If you could provide some kind of an explanation for the layperson about what it is that your job entails.
Certainly. So I oversee our admissions department for our inpatient behavioral health program. Inpatient psychiatric services is the highest level of care an individual can receive for behavioral health issues. That program is in our hospital. It is a program designed to provide psychiatric care for individuals who are in acute distress. So we provide that care by keeping someone safe within the hospital, as well as provide therapy and psychiatric treatment at the same time. So I oversee the admissions department, which is located in our emergency room. We do approximately 350 behavioral health and substance abuse assessments every month. Very busy. We're a very busy ER. And approximately 125 patients are admitted to our inpatient behavioral health program every single month. As I said, I also oversee our strategic planning and regionalization of behavioral health within our hospital and within our communities. So what that entails is me collaborating with the community, such as being in school programs, working with school administration within Chester County to talk about what their initiatives are for mental health, what is important, what's salient within the school district that they would like to work on, and we partner with those schools to help provide that psychoeducation. I also work with other hospitals within our county to help them understand our services and to help them bridge the gap of getting patients into the type of care that we provide. Brandywine is the only hospital in our entire county of Chester County that offers inpatient behavioral health care for adults. The only one. So it's pretty unique. And then lastly, I work with our hospital system, which is called Tower Health, which is comprised of 6 hospitals: Brandywine Hospital, Reading Hospital, Chestnut Hill, Pottstown, Jennersville, and Phoenixville hospitals. And so I work with all of those hospitals, and we talk about what our expertise is in behavioral health care, who's doing what, who's not doing what. We share ideas, we share resources, and we strategically plan to make sure that our respective communities have everything that they need in terms of behavioral health services that we can offer from the hospital.
Thank you. Cheryl, same question.
My job is, as an oncology nurse navigator, is to meet with patients once they've had an abnormal diagnostic test that may move forward to a biopsy. It's a little frightening for patients that have been told that they're going to need a biopsy, and so I will walk them through what that means and the next step. It doesn't necessarily mean a cancer diagnosis, but it means that more information is needed. So people, when they receive that information, there is a little bit of fear associated with that. And then if the biopsy comes back where it's positive, I then begin a more intimate relationship with that patient, and I'll walk with them through their journey and their appointments and help them to identify resources through an assessment that I do to identify any barriers that might be in existence from do they have food, do they need clothes, do they have any barriers that would prevent them from receiving their cancer care. That's really important, because identifying what barriers are there are important so that they can focus on their cancer care. And barriers include identifying fears so that they can, move forward in their cancer treatment. I remain a part of their journey, and it can be that they have no fears or they have no needs to somebody that is sitting in the dark for fear of using electricity because they don't have the means to pay for it. So it can be a very there's a lot of different aspects to it. But I remember very distinctly being your age and in your place, wondering, what do I want to be? How can I make these decisions? And how can I make these big decisions at this time? And it's really overwhelming. And for me, it was just a matter of looking at the overall picture and deciding what my likes were, what the things that I liked doing were, what was going to open up doors for me, what was going to open up the pathways, and how did I need to focus on making those decisions that would kind of lead in opening up those pathways. So I think it can seem overwhelming, but if you break it down to what you like and then what your interests are, and then how you can use your likes and to then go into a career that can be good for you, and then you can use your skills.
Cheryl, thank you. I like to provide students the advice similar to you, that when they ask, well, what would I like to do with my life? Well, it's too big a question. You can't wrap your arms around it. The real question you should ask in your teenage years, and always, frankly, because so many of us end up changing careers, I know I did, is what do you like? What do you enjoy? And then find a way to get paid to do those things. Right?
Yeah, I like to eat. Not to get
Well, Leo, clearly you also
I like to eat.
You also enjoy what it is that you do at the hospital. So if you could please explain that.
I do. In my particular job, I'm closing in on 40 years.
Congratulations.
And I don't know if that's a good one thing or not, because I got more years behind me than I do in front of me. But I'm a registered nurse and I'm a paramedic. And I don't work in the hospital as much as I work outside the hospital. I'm the guy in the ambulance. And for a good part of all of my life, I've been and again, when you look at careers, I was a phys ed teacher long ago. Had a change in careers, became what was called an emergency medical technician, began doing ambulance work. From there, I became a paramedic. And the difference between an EMT, emergency medical technician, and a paramedic, the EMT does a lot of the basic maneuvers that somebody might need in the back of an ambulance. The paramedic starts to begin doing a lot of advanced procedures like you would see in an emergency room, starting intravenous lines, giving medications, using a heart monitor, all that kind of stuff. Maybe one day I can come back and I can bring all my wares with me. Began there. My entire career in emergency medical services has been at Brandywine Hospital, especially as being a registered nurse. As a registered nurse, you can work probably 30-some different jobs in the same organization. But my allure has always been outside of the hospital. I like being outside the hospital. I like taking care of people from birth all the way to being 90 years old in a nursing home, that entire spectrum of that. So yes, have I delivered babies? I've absolutely delivered babies. Have I helped people pass on into the next world, wherever that may be, as an elderly person? I've always done that too. Do we see things that most people we don't want to see? Sure. But I always believed that the things that I see, I know that people are going to get hurt and they're going to get injured and they're going to get sick. And I'd much rather them get hurt and sick where I can take care of them, because I think they're going to get a quality thing. But anything I do is mostly outside of the hospital and the ambulance work. I'm most proud of back in the day, I spent 15 years in helicopter service. and I was a flight paramedic and a flight nurse. That is the pinnacle of my career, doing the things back then. And it was a tremendous enjoyment just to fly around free in a helicopter most of the time, but had a great experience. But mostly what I'm doing is that pre-hospital. If you hear pre-hospital, is outside the hospital. But remember that anybody that I take care of, I have to bring to a hospital. And then maybe later on, we take them home.
I think I appreciate what Leo is saying about bringing care and compassion to any aspect as a nurse, and David too, be it mental health or pre-hospital. I began my career as a surgical trauma ICU nurse, and then I went into become a transplant coordinator, and then I became a case manager, and now I'm doing oncology nurse navigation. But no matter what the RN is doing, whatever they're doing, whatever aspect, be it pre-hospital or in-hospital or mental health, to be able to offer that care and compassion, because those people matter. And no matter what's going on in their life, to be able to get them out of that acute situation and moving on and to restore them, that's always the goal of the healthcare professional, to identify and assess what's needed for safety. I think you used that word, safety, and and that's always essential in the pre-hospital, the safety, and then moving on, and then to restore them. And I think that's what we're probably the most proud of, is to do that in a way that is compassionate. And at Brandywine Hospital, it's a small little community hospital, but I can say that the care that's offered there is always with compassion and great care.
David, if you could take us through sort of a summary of your journey to where you are now as well, please.
Sure. And I'm glad you asked me to do that, because Dr. Podell talked about, even as a teen, thinking about your career, your interests, your likes. When I was a teen, my interests and likes were sports, and that's where it started and that's where it ended. For me, the sun rose and set playing sports, and I'll bore you with a quick detail that started my path, which was I had a sports injury in high school, and that really derailed any notions of any type of collegiate endeavor, playing sports, and potentially beyond that. And I struggled for a while in really finding and figuring out what my interests were, what my identity was. It really took me until my third semester at Westchester University, 3 semesters into school, not really knowing what I wanted to do. I knew I wanted to do something, and so I started my college courses, but I didn't know what it was. I actually started out taking accounting classes. Why? Because my brother was finishing law school, and my dad was a businessman. So I must go into business. I mean, that has to be what I do, until I realized I had to take a withdrawal from accounting before I failed the class. And I knew that field and career and education was not for me. And it took me within 3 semesters to figure out, I'm good at socializing with people. I'm good at talking with people. I'm good at making people feel comfortable. I'm good at understanding a room of people and really knowing what each person is thinking at the same time. And so after having some classes in college, I realized, I can make some money doing that and start a career doing that. And so I changed my major to psychology at Westchester. So I finished with a psychology degree at Westchester, and then I continued to pursue my master's degree in counseling psychology at Immaculata. And so I spent a lot of time over the past 25 years providing counseling and therapy in various settings here in Chester County with kids, adults, individual therapy, group therapy, all kinds of settings. Then 7 years ago, I was fortunate enough to have an opportunity to become a member and employee of Brandywine Hospital, where I am now. One piece of advice I would give to all of you in terms of not only just looking at your interests and then gearing your studies in college and beyond towards those interests is when you're building a career path, an important thing to remember is that path is not only just about your skill set as a professional, it's also about being able to have relationships with other human beings.
Amen.
Amen.
And I know it's probably kind of a topic that you guys have been talked about or talked amongst yourselves about, the social media age and everything that goes with it, and the decrease in the amount of face-to-face interpersonal connections we all have because of that. And I'm not going to bore you and preach to that, but I do want to tell you how important it is for opportunities to open up to every one of you, not just because of your skill set. You might get into, you might have opportunities because of your skill set. Frankly, more often than not, you have opportunities presented to you because of your ability to interact and interpersonalize with people and communicate and develop relationships.
That's really good insight.
And that's what opens the door. Then once the door's open, then you get to show your skills. But it's really important to remember that. And those relationships and those experiences, you're going to build for the rest of your life. Your skill set in how to communicate and interpersonalize and develop those relationships. But it starts now. So I would encourage you to make sure that you're putting yourself in situations socially, interpersonally, that maybe are a little bit uncomfortable. Different environments, strangers, different people, whether it's a retreat or anything in school. Those types of things I hearken back on, and I think when I did that and I felt nervous or uncomfortable, I absolutely know that contributed to my abilities, my interpersonal abilities as a professional and as an adult.
Can I just add to that? I think that's really great insight, but I think that those skill sets that you're talking about, don't you think we're constantly building those even, I mean, I'm an older nurse now, and I think I'm still learning these things and I'm still building those things. So the things that he's talking about, interacting with other people and learning to do that in a successful manner that's positive is something that's always evolving and always ongoing. And I think there's challenges now with the technology age that are out there that we need to consider and now adapt into our repertoire.
And I do that every day with my 18-year-old, 16-year-old, and 13-year-old daughters.
And your colleagues.
More my daughters. I try and figure out those challenges, but it's that journey of developing those skills is a lifetime journey.
Yeah.
It's kind of Carol Dweck's growth mindset, right? That none of us are ever finished products, and the idea that the cliche is to push yourself out of your comfort zone, but there's wisdom in the cliche. There's a reason why cliches become cliches, right?
Right.
Being comfortable with being just a little bit uncomfortable and testing and pushing past some of those personal boundaries that we set for ourselves. The value of networking really can't be overstated. The number of jobs that are never posted anywhere, right, that get filled, or the number of jobs that are posted but only because of legal requirements,
right,
when the hiring manager knows full well who it is that they're going to hire.
Yes.
It's really quite stunning.
Are we all seniors? I mean, I'm a senior. I got my card in my pocket saying I'm a senior, but what grades? Any grade? Freshman? God bless you. All right. Now's the time to think of what I want to do somewhere along the line.
Right.
But not specifically. Maybe I want to be a veterinarian now, and maybe 3 years from now I want to be a plumber. It's something that you want to be, that you want to do, that you think you're going to be able to do. And to go along, and after working with David and working with Cheryl over the many years, they are masters at their craft. And there's one way that you master that craft is by practicing that craft. And I've always said to people that experience intuition, don't be afraid. Don't be afraid to move out forward. And I always say to people, experience intuition can't be taught in a book. It can't be taught in college. It can't be taught here. It can't be taught there. Experience intuition is when you begin to practice your craft, but it's only solidified by time. And as time goes on, you make that. But one more thing, I think, before we maybe have some questions or something, that when I look at someone that's a new, and I've hired hundreds of employees, I've never fired anyone. Now, that doesn't mean there's hundreds of employees working for me. I've always helped them be successful somewhere else, because I believe that. I believe that I may not be the fit for them right now. They may be able to be better fit somewhere else. And I have released people over the years, and they've made better for it, and they've come back to me and said thank you. But knowing that, this is what I look when you one day go out for a job interview. Be a great person. Be the best person you can possibly be. If you're looking at healthcare, you've already got 90% of that done because you want to help your fellow man. But be a great person. My dad always said, how can I help you be successful today? And I've lived my life by that. I can make you a good paramedic. I can make you a good nurse. I can make you a good plumber. I can make you a good technician. I can't make you a good person. Only you can make yourself a good person, which means you got to hang with good people. Because someone says, Leo, you're the best. And I said, I'm only the best because I've hung with the best. And they've made me better each year. That's the only really advice I give. I don't give a whole lot of advice in my life, but I say give a new parent, I'll say the only advice I'll give to a new parent is when the baby sleeps, you sleep. That's it. That's all I got. The rest is learning for you. But the thing is be the best person you could possibly be. Walk a little softer, talk a little easier, and people will love you for it.
I think you are known by the company you keep, and you're known by the footsteps you make. And that you make a good point with that, Leo, is that you will be known by the words you speak, even here, even now. People are watching the words that you speak, the steps that you make, and how you handle yourself.
The tweets that you send.
Yeah. How about that? And that becomes how you're known, how you respond in crisis, or how you respond in difficult situations. Every difficult situation gives you the opportunity to reflect your character. Anybody can have it, when things are going well and it's a good day. Any one of us can respond easily. But when the crisis happens and the crunch is there, how are you going to respond? That's when true character is tested, but that's an opportunity to reflect the character that you want to be seen. Before I forget to tell you all, I did bring some brochures over on this table about the navigation services and the women's services. And something our medical director has asked is that we provide breast self-examination cards, not only for the ladies that are here, but for the ladies at home that you might have, if you have moms or aunts. Breast self-exams are being done and helping women to find tumors or things that need to be looked at a little closer, and it's very important. So pick up one for yourself and for those ladies at home before you leave here today. That's the education from the Nurse Navigator.
Do we have questions from the audience?
Come on.
I have a bit of a wonky question, if you guys don't mind.
Wonky.
Wonky. That's how I am. David, you'd mentioned a few moments ago about the network of hospitals that Tower Health has acquired over the past few years. And I understand that Brandywine itself has gone from a for-profit model to a non-for-profit model. And I'm curious how that's affected your jobs and your mission as an organization.
You guys feel free to
I don't worry about the money. I think my mission
touche.
doesn't change whether I'm for-profit or non-profit. We all have to make a profit. All depends on what tax structure the organization is under. But certainly in a for-profit situation, you have investors that you have to take care of. We still want to give the best medical care we can possibly give, but there's some constraints with that. A nonprofit organization gets to keep everything that they make, or if they're successful.
Ironically, I started my nursing career at the Reading Hospital many years ago in surgical trauma ICU, and as a transplant coordinator, I ended up visiting every hospital in the tri-state area, and I took away with me that the best nursing care I ever witnessed was at the Reading Hospital. And the Reading Hospital is the mothership of Tower Health. And I do believe that commitment to patient care, excellent patient care, is what they're bringing to each of the hospitals that they have acquired. And they are committed to excellent patient care. And being a non-for-profit, they're able now to invest many more resources into each of our hospitals. We've already witnessed that significantly with improvements that we're seeing in our hospitals, the resources that they provide each of our departments, and I think that will continue to improve in our community. So we're all excited about the changes.
And I would just add to that, Cheryl mentioned a few minutes ago about how it's been a privilege to work amongst people at Brandywine for the years that she's been there that provide that great patient quality care every day. And so when it was we were for-profit or now not-for-profit, and as Leo said, that really hasn't affected every nurse, doctor, therapist, tech, or housekeeping employee in the hospital in terms of the way they do their job on a day-to-day basis. So the for-profit, non-profit doesn't really affect the direct people that are really caring for the patients. But as Cheryl said, the resources, believe it or not, it's really hard to understand sometimes what the differences are between for-profit and non-for-profit. It sounds like it's easy. For-profit, you make money. Non-for-profit, it's not so important. Well, it's both. It's important for both.
Right.
But really, the one thing about not-for-profit is that there are regulations that make it that hospital has to, by regulation, invest in their hospital resources.
In the community.
So they have to put money back into their hospital and the community. It's a regulation. And so while we've always continued to provide great care, we've really been fortunate over the past couple of years to have that reinvestment back into our hospital and community that really helps each great employee provide the best care possible. Yeah. So we're in a really good spot.
And then think, what if you're all invested in healthcare? What are your options? And you'll start thinking that. Am I going to work to live, or am I going to live to work? That's what you got to think about, right? I kind of do both now because it's been a really good career. It's been I won't tell you how much money I make, but I do okay. My wife and I do it. The three of us are only 3 out of about 30 departments in our hospital that have directors, that have employees, that have other people that work in the hospital. 750 employees just at little Brandywine Hospital. There's opportunity in healthcare to continue to work. The aging of America is only going to have that happen. In the last 20 years, there's 100 million more people in the United States than there was 20 years ago. So think about that. There's people that need to take care of others. I became a nurse, one, because I like taking care of people, but also because I knew I'd always be employed. Because there's always a human need. And if that's something that you want to do, I think you should look at that. But, and your careers change. I was a phys ed teacher. All right? And I said, you know what? I want to do this other stuff because I got interested in doing ambulance work. And then I became a registered nurse. But you know what? I've been an educator for many, many years too. And every day that I educate, I use some of those skills that I had when I first learned when I became a teacher. So those are the things that you have to begin to think about. Don't be afraid. Don't be afraid to change your mind. Don't say, but I wanted to do this, I wanted to do this, I wanted to do this. Start thinking what path you're going to take. The path may meander. It doesn't have to be straight. Okay? And the thing that you most want to do is enjoy yourself and not have to work 900 jobs and only be worried about that.
Right.
And you got your whole lives ahead of you, and I got my whole life ahead of me. I don't know what else I can think about. But it's what we do. We are always learning. When you get out of high school, sorry to say, everybody, you will have mastered the basics because the rest of life's learning is ahead of you.
That's why the final ceremony is called commencement.
That's right.
And not, the end. It speaks
That's
to
right.
the beginning.
That's right.
And to your point, it's Dwight Eisenhower's sage wisdom that the plan is nothing, but planning is everything.
That's right. That's right.
30% of college undergrads are going to change their major.
Absolutely.
75% of us bachelor's degree holders are working in unrelated career fields.
Mm-hmm.
So overwhelmingly, the path will not be linear, right?
Right.
It's going to meander.
Right.
And that's important, being.
But you can't say that any learning that you had is a waste of time.
Right.
Any learning is always worth the time. Whether, if I go learn how to be a plumber and I'd never use it, guess what? I still had that learning and there was still a place in there for me.
Questions from the audience?
Come on.
They're there.
You mentioned that as a not-for-profit, there's some requirements in terms of investing in the community. Are there specific needs amongst each of those 6 hospitals that each community kind of differs and impacts the way that you invest in the services you provide?
We just completed a community needs assessment in our area, which has identified our specific needs. And what would you think, just living in this community, what would you think one of the needs came out as identified for our community?
There's 3 of them.
I think for transportation was one. There's a big need for transportation for the community to be able to have transportation to get to health services.
No cabs, no buses, no.
So that's a big need. And we as healthcare professionals have patients that need to get to their services but can't get there. So that's a big need. What would be another need you might think is out there?
Throw it out, guys.
Dave?
Something he's been talking about.
Behavioral health.
It's in the news a lot.
I'm going to go ahead and guess psychological services.
Yep.
Psychological services, the opioid crisis is huge, and it's here, and that's a big one. So we need to be able to meet those needs. So the community needs assessment was important for us to be able to know how to identify. There's another one that came out that we have to identify that we are incorporating in all of our education, and we're now trying to join teams to make sure we're all having the same messages, and obesity. And so trying to make sure we're incorporating education about nutrition, exercise, because that directly impacts mental health. It directly impacts survivorship and cancer. We know that research is saying that proper nutrition and exercise not only impacts whether or not you have a risk for cancer, but afterwards, after you've had cancer, survivorship messages are important to prevent reoccurrences of cancer through nutrition and exercise. And so those are important messages for us all to be able to maintain. But challenges, how do we increase the exercise and not just your population, but from birth on up, in helping our families to increase exercise as families, helping our young people to increase their exercise. It's going to promote better mental health. It's going to decrease cancer. So that's important messages. So we're going to start holding community health events, and we have the Relay for Life event that's coming up that I have a team called Team Brandywine. It's going to be at the Downingtown West High School, May 18th.
Ooh.
Come join my team or support my team.
Ooh, that's
so
blessed.
that's going to be, that benefits the American Cancer Society. They provide so many free resources to me that I use this event as a way of trying to earn some money for them, or raise some money rather for them. So, but that's one event that's promoting.
You have a challenge ahead of you. Since the birth of the United States, every generation has outlived the previous, up until your generation.
Right.
Your generation will live shorter period than my generation or my kids' generation. Not by a lot, but it's a trend that we don't want to continue. And that generation will have more disease in it, and that is because of what Cheryl's saying about obesity, lack of exercise, our diets, all that kind of stuff.
And opioids.
And let me come back for one of those days on opioids. I'm on, and Dave
That's
goes
a
with
whole.
this.
That's a whole other day, and
I'm
they're
on-
well prepared to present a day
I'm on
that.
3 different committees. I'm on opioid crisis. And this is the only thing I'm going to say about anybody? I have 8 personal families that I know
Yeah.
that have had several die in those 6 friends of my children have died because of the opioid crisis.
I can say that I know personally.
It touches everybody. But what I'm looking for you to do, and as you move forward, and I don't want to lay this on you, be policymakers. All right, there's a lot of people that follow policies, and there's a lot of people that make policies. What is your challenge as you move ahead? Maybe it's a little corny, but be a policymaker. A good friend of mine, a friend of my son's, that went in the Air Force, and he just completed his master's degree. And I said, now you should go and get your PhD. And he says, why? I said, because I want you to be a policymaker. Don't be a policy follower, be a policymaker. And he's probably going to do that, because I believe he can do that. And I believe everyone can do that if you feel that you want to do the work. It's not easy, if you want to do the work. But yes, maybe one day we'll come back and talk about opioids, because it's incredibly important. It is not going away. It has not peaked. The only thing that has peaked is our willingness to accept an acceptable amount of deaths. The only acceptable amount of deaths from opioids is 0.
If I could, we have one more minute.
Yep.
We could end on perhaps a slightly more positive note. What's the best?
Was I the Debbie Downer?
No, not at all. It was authentic, and I'm very grateful to you. Thank you. What's the best part of your job?
Paycheck.
I think the best part of my job is when somebody comes in with a cancer diagnosis, and it's overwhelming, and it's horrifying, and it's scary, and I can walk them through that journey, and they can come to the other side of it. But I've promised them that we will get them to the other side of it.
Absolutely.
And we do get them to the other side of it. And then we use that C word that I like to use called cure.
Yeah.
And we at Brandywine Hospital can offer them the same services as if they were going to the University of Pennsylvania, because everyone is using the same guidelines, the NCCN guidelines. If it's not a really super complex cancer, if it's super complex, thank God we have the tertiary centers in the city. But if it's not complex and it's a simple, we can offer them the same services, and I can get them on the other side of it. So that's the best part, when we get them on the other side.
I would just quickly say, years ago, my answer to this would be that I feel really good when I'm doing my job. It doesn't feel uncomfortable. I don't get nervous. Because I feel really good at what I'm doing, and I'm really confident at it. And so the best part of my job was knowing that when I met with a patient, that patient was going to feel a sense of connectedness with another human being. And that's why I'm in the field anyway. And so but now I think that my answer is that I have the privilege to be in a position to train younger individuals, younger adults, younger employees at the hospital on the same skills that I developed in how to connect with human beings and how to interpersonalize and how to do the best job that you can within this field that is my expertise. And so that's the best part of my job, is going in every day and meeting with my staff and really knowing that I have that opportunity to educate and train them.
That'll be where we leave it, I
Yeah.
think.
Absolutely.
Thank you very much, all three of you, for being here with us. Ladies and gentlemen,
Thank you for
big
your
round of
time.
applause. That'll do it for this edition of the Career Cafe. Thank you.
Thank you, everyone.